So here's the lungs. Oh, I should probably take the pieces too. The region between the lungs is called the mediastinum. The main organ in the mediastinum is the heart. So here's the left side. There's the cardiac notch of the lungs. Down on the bottom is the base. It's sitting right on the diaphragm. That's the diaphragm. The base of the lungs is sitting on the diaphragm. So the parietal pleura is against the diaphragm. Up at the top is the apex of the lungs. Now on the left side, there's one oblique fissure. Very dirty, this model, but clear. So the oblique fissure shows you that this is the superior lobe, this is the posterior lobe. The way it's coming down obliquely, most of the inferior lobe is in the back. Most of the superior lobe is in the front. At the apex, you might get some of the inferior lobe. No, the inferior lobe is basically behind. Now, if we look at the right side, it has this oblique fissure coming through here, right here. Everything behind it is the inferior lobe, mainly in the back. But it also has this horizontal fissure, and that separates out a superior from a middle lobe. Superior right, middle right, inferior right. Call that right or left if I put this on the test. So superior and inferior left. I also can show it open, at least on the right side, superior, middle, inferior. We saw the larynx up at the top. It ended, and then we had the trachea with these half-circle rings of cartilage. At the bottom, the trachea bifurcates, and this glass piece of cartilage looks like a bikini bottom strap. That's the carina. So there's a main bronchi going to the right side and a main bronchi going to the left. If I put a piece of tape over here, this is the left main or primary bronchi. If I put it over here, this is the right main or primary bronchi. On the left side, it divides into two other bronchi, secondary bronchi. One will go to the superior lobe, the other goes to the inferior lobe. Then they'll continue to divide into tertiary bronchi, to bronchiopulmonary segments, and then they become bronchioles. The main difference between a bronchiole and a bronchi, as I see it, is that bronchi still have cartilage, so they always remain patent. Bronchioles, all that cartilage is replaced with smooth muscle. So you can constrict a bronchiole completely. They don't have to remain open. So people with asthma, where they get constriction of their smooth muscle of the bronchioles, they have a hard time, especially with breathing out. Because when you breathe out, the lungs are contracting. They're recoiling and getting smaller. And that closes the bronchioles to begin with. If they're in spasm, people that have asthma, when they breathe out, you'll hear a wheezing. Because they're trying to breathe air out through a tiny hole. It takes them longer to get air out. So on the right side, there are 3 secondary bronchi. So if I say, what's this? This is a right secondary bronchi. This 2 and this 2. If you look at the right side, and not to be tested on this, but it comes down here more horizontal. The left side, more vertical. The left side seems to be more horizontal. And the left side, because it's only dividing to 2 secondary, is a bit thinner. Notice the right side is thicker. It's thicker and it's more horizontal. So if some elderly person has Parkinson's or MS and starts to have problems with swallowing, food and water seem to find their way past the glottis, end up down the trachea, and end up in the right lower lobe. Most aspiration pneumonias that we see near the terminal stages of Parkinson's or MS, because people can't swallow anymore, tend to be on the right side in that lower lobe. And it's a function of the fact that it's more horizontal and wider here. Typically, healthy people, when we swallow food and water, we don't have that issue. So that takes care of the lungs, the models. I know this for lecture. Being that I'm going to have to think of questions, if I run out of questions, I could use it. This cartoon drawing is of an alveoli. This is where respiration takes place. Bringing air into your lungs from the outside, because the lungs expand, that creates negative pressure. Bringing air down to the lungs is called ventilation. Once we bring the atmospheric air into alveoli, now we get an exchange of gases. That's respiration. 2 different physiological processes must occur for us to oxygenate our blood and to rid our blood of carbon dioxide. Ventilation, we ventilate our lungs. Respiration, in this case, external or pulmonary respiration, where we're taking oxygen from the atmosphere and giving carbon dioxide into the atmosphere. So as we get into the alveoli, there are 3 types of cells. And you have to know this for the test tomorrow anyway. The type 1 cell, the most common cell, simple squamous cell, very thin. This is for respiration. Because the content of oxygen, the partial pressure of oxygen in the atmosphere, what was it, something like 165? In the blood, it's like, the venous blood, it's like 45. So gases move from higher concentrations to lower concentrations, but we don't talk of concentrations with gases because they don't have a defined volume. What they do have is a partial pressure. It moves from an area of a higher partial pressure into an area of a lower partial pressure. And they do that by diffusing through squamous epithelium. They share the basement membrane with the squamous epithelium of the capillary. So it makes it very easy. Oxygen goes in, carbon dioxide comes out. Partial pressure of carbon dioxide in the atmosphere was less than a half. No, it was 0.04, way less. So it's maybe like 45 millimeters mercury pressure in the venous blood. So carbon dioxide will come into here. That's pulmonary respiration. carbon dioxide comes out, and oxygen comes in to the bloodstream. So type 1 cell, simple squamous for exchange. Type 2 cells, I think they point them out as the green things here, they make surfactant. Type 2 alveolar cells make surfactant. When we exchange gases, to make it easier, the respiratory membranes start to warm and humidify the oxygen. So there's a lining of like watery substance here. When the diaphragm moves down, the external intercostals move up, the lungs expand. The alveoli get larger. Air comes in. When you breathe out, the diaphragm relaxes. The external intercostals relax. Mainly connective tissue in here. Elastic connective tissue, so it contracts. When the walls of the alveoli get close together, surface tension from the fluid prevents them from opening up. Surfactant breaks that surface tension. Without it, we can't effectively exchange oxygen. And the third type of cell is a macrophage, or a dust cell. Macrophage to gobble up debris. Oh, that's another point of the lungs. It's marked off like in dark brown. That's known as the hilum of the lungs. The bronchi go into the lungs through the hilum. The pulmonary arteries and pulmonary veins come out of the lungs, in and out of the lungs through the hilum. So this is the hilum over here, and this is the hilum over here. Connective tissue, that's going to divide the lung up into lobes and then eventually into lobules, all enter through the hilum. So the medial portion of the lungs is called the hilum. It's where the root of the lungs forms. So this is what normal lung tissue looks like, and I want you to take out the microscopes just quickly, and we don't have that much to do. Look at the lung. Now I started to set it up on here. Can you see how this kind of looks like that? I found a spot right over here that's probably a respiratory bronchiole. And all of these are the alveoli. And there's probably blood vessels right here and here. Look how nice and airy it is. And you have all this membrane, so the exchange of oxygen is as if it was a racquetball court. So the walls of the alveoli are these flimsy, very skinny squamous tissue. That's a nice, healthy lung. Now, if we were to look at this, and we don't have pictures in the book, so you have to look at the actual slides. If you look at that, does that look like the other picture? Can you see how if blood vessels are here, they can't exchange most of this lung, this air in your lung. They don't have all those little squiggly lines going through it. They just have these big blebs of air, and blood vessels are out here. So you're taking air into your lungs, but you can't exchange it effectively. You don't have a racquetball court. You just have this little area to exchange. This is what emphysema looks like. So if I put up 3 microscopes side by side, you would look at the normal one, you'd look at this one. You see large bits of air, that's emphysema. This is what happens when you smoke and the irritants get to the squamous lining. They start to eat away at it with time. And even if you don't smoke, this is what happens if you're lucky enough to live long enough without getting hit by a truck. We're going to eventually have some degree of emphysema. You can see this isn't healthy lung. The other one was healthy lung. The other thing would be carcinoma. So they have slides there of lung with carcinoma. Again, this doesn't look like that healthy lung. I'm not sure exactly what I'm looking at, but I'll tell you one thing, I don't see areas to exchange oxygen. This is just infiltrated with cells. As far as I'm concerned, this could look like a pituitary gland. You know, I mean, this is just filled with cells. So if I put up a slide and you don't see nice defined airways, that's probably a carcinoma. One more time, here's what a healthy lung looks like. See, and I can go almost anywhere here. This isn't moving very well. But I don't see anywhere here where I can find where oxygen can be exchanged. Blood supply would be smart enough. The pulmonary artery that carrying the oxygenated blood to be exchanged would probably try and stay away from this region because it would see there's not much oxygen there. It'll try and find the healthy lobe of the lung. That looks more like this.
What causes carcinoma?
Cancer, cigarette smoke, just mutation. For some reason, the DNA within the cells mutated and they change what they are. They go from simple squamous to something else, and then they don't respect their own boundaries, so they just divide uncontrollably. So I might put up something like this. Actually, I like this slide better when we went to higher power. Like that. This is what healthy lung looks like. Well aerated, not big blebs of air. There's plenty of membranes, and you can see some red in those membranes. That's where capillaries are. Right? This looks like normal tissue to me. If I see big blebs of air, it looks like emphysema. If I see it just filled with cells, it's probably a carcinoma. So take out microscopes,